Hi everybody, I am Dr. Mary Claire Haver. I am coming on live here today to talk to you about perimenopause. And I'm going to wait just a second for some of you guys to come on live while I pull up the notes. As always, I research everything I talk to you guys about to make sure I'm giving you factual and up-to-date information, and especially to try to dispel some of the misinformation and misunderstanding around perimenopause and what you can do about it. Hang on, I'm turning off. I'm in clinic. I have a break right now between patients, so I thought I would jump on live and do a little bit of menopause education, perimenopause education for you guys. Okay, so it looks like we have a nice number. So hi, if you're just tuning in, I am Dr. Mary Claire Haver. I am a board certified OB-GYN. I'm actually in my clinic right now, Mary Claire Wellness, between patients. I've got a break. Thought I would come on live and do some perimenopause education. TikTok gives me all these notifications. Please like this video here. Up here where it says Gals and Diet, that's my like button. You may have a different one. Also, if you have any questions, just put them in the comments below and I will try to get to them. And you can share this video with anyone you think will benefit from this information. So keep your questions coming. Let's see. Can you advise on how to cope with menopause, symptoms while taking tamoxifen? Please, you're not allowed HRT. So if you are on hormone replacement therapy, then you are not only in menopause, but any residual estrogen that you have is taken away because your receptors are blocked by the tamoxifen. This is in an effort to decrease your risk of recurrence of your breast cancer. I'm assuming that's why you're on tamoxifen. And women who are on tamoxifen do experience more severe menopausal symptoms. There are a lot of things that you can do. If you're suffering from hot flashes, most of my patients, I would put on Neurontin. Neurontin is a medication that's been used for years. It's used for chronic pain. It's used for phantom limb pain. It's used for restless leg syndrome, sometimes for depression. It can blunt the effects of hot flashes. So that's one thing. Clonidine is also another medication you can talk to your doctor about you might be a good option to help with the hot flashes. If it's brain fog, 100% hands down, intermittent fasting is going to be your best bet to help combat brain fog and inflammation. And so when you can't take HRT for whatever reason, we basically start treating your symptoms on an individual basis. So you may have to take, medication X for your hot flashes, medication B for your depression, etc. So, all right, I'm going to go back to my notes real quick. So please like this video. Thank you for liking the video. TikTok keeps sending me these notifications. When you like the video, it keeps me relevant on the app. And so menopause marks the end of your period. So when we talk about menopause, it's actually one date in time. And it is when your female reproductive organ, the ovaries, in fact, have shut down and are no longer producing estrogen. Perimenopause, on the other hand, means around menopause, literally. And there are actually different stages. So when we talk about premenopause, that is a time when your ovaries are starting to shut down, but you're not having any symptoms, okay? It's kind of a gradual process, and in the beginning, you really won't notice anything. Perimenopause is when you start having some of the symptoms associated with the lowering of estrogen levels. And these symptoms, some are very well recognized, like hot flashes, like mood swings, like brain fog, irregular periods, etc. But there are probably 30 other symptoms that we are really starting to dive more into and discovering that are related to decreasing estrogen levels. Visceral fat deposition leads the list. Number 2, palpitations. Number 3, worsening mental health disorders. Number 4, worsening autoimmune disease. Number 5, worsening joint pain, muscle pain, aches. All of that has something to, can be attributed to estrogen decreasing. Why? Why is that? Well, estrogen has multiple functions in the body, and we're discovering more and more what it can do. It's a powerful anti-inflammatory hormone. It helps keep cholesterol down. It really defines, where and how we store fat in women. And when we start, most women, not all, have a body composition changes as they go through perimenopause. Where you started depositing fat switches from usually about the hips and thighs for most women to suddenly having fat deposition in the abdomen. Okay, so there's 400 of you on right now. Welcome. TikTok makes me do these notifications so I stay relevant on this silly app, but I love talking and I love teaching. If you don't know me, I'm Dr. Mary Claire Haver. I am a board certified obstetrician gynecologist practicing in Texas. Yes, I have a clinic. I'm here right now between patients. I had a cancellation, so I'm like, let me go live and do some teaching. So you must be physically in the state of Texas in order for me to see you. I do virtual visits. You can learn more at maryclairewellness.com. I'm also a nutritionist. I am certified in culinary medicine, and I do a lot of talking and teaching about utilizing nutrition to help us through the menopause transition and to combat this unexplained weight gain that happens to so many of us in midlife. You can learn more about my program at galvestondiet.com. We're having a sale. We're having a sale right now, 20% off sale on all of our programs. If you use the code HOLIDAY, HOLIDAY. Okay, hi, currently in Houston applying to medical school right now. Where do I live? I live in Galveston, Texas, which is why I call it the Galveston Diet. It's an island about 50 miles south of Houston. I practice medicine just outside of Houston, though. My clinic, I'm closer to where the population center is. Galveston is very small, so my clinic is where more people will come and see me. Okay, so let's see. Perimenopause, grossly misunderstood. Almost no teaching about perimenopause in medical school or residency. I can tell you there's probably no teaching about perimenopause in medical school, and in residency it is absolutely the bare minimum. But here are the facts. The ovarian production of estrogen starts shutting down 8 to 10 years before the onset of menopause. Okay, menopause, remember, is your ovaries die. They're done. You'll never have another period. You'll never get pregnant again. Okay, that is the average age of 51. So do the math. If your ovaries start shutting down 8 to 10 years before that, and it's normal for menopause to be from 45 to 55, average is 51, but 45 is still normal. So back it up 10 years. 35 is completely reasonable to start experiencing symptoms associated with menopause. It's a little early, but it's still normal. So when you go to your doctor or your healthcare provider and you start discussing and wondering and pose the question, could this be related to perimenopause? And they immediately blow you off and say, no, you're too young, they're wrong. Now, I'm not trying to throw them under the bus, but they just aren't educated enough about it, okay? They are wrong. So, 55, remember, if you're still having periods at 55, you're still at the very edge of normal. That's still okay. If a year goes by and you're still having a period, it's time to see your doctor. Okay. All right. So the most common changes associated with perimenopause are cycle changes, irregularity. So you start skipping periods or they seem to be coming closer together. Hot flashes. Yeah, that was me for sure. Sleep disturbances, usually related to hot flashes, and mood swings and brain fog. So those are kind of the top recognized symptoms. But perimenopause will occur well before your periods stop, well before the actual menopause. Remember that. You're not too young and you're not crazy, okay? We just don't have enough education, and there's many, many reasons for that. In the OB-GYN residency, which I was a residency director and I did my own, we spend more than half of our time on obstetrics. Very important stuff. Learning how to safely deliver babies, all the medical complications that can occur in pregnancy, how to treat them, how to get a woman from not pregnant to being pregnant to staying pregnant to delivery and postpartum. Okay. Then we spend a lot of time, like 40% of what's left, on surgery, learning surgical techniques, how to do a hysterectomy, remove ovaries, cervical cancer, all the things, okay? Then, finally, whatever's left over is gyn oncology, pediatric gynecology, all these things. Menopause is not even like a rotation. We don't do a menopause rotation. It's kind of just swept under the rug and thrown in with some other stuff. Though more women will go through menopause than have babies. 100% of women, if they live long enough, 100% will go through menopause. And it is shocking to me now that I'm out of training and having all these patients who are menopausal, that I basically had to take myself back to school to learn what I needed to learn to take care of these patients. So if your doctor is not telling you what you know is factual, they're not lazy, they just weren't taught. And so you need to find someone who is a menopause specialist, okay? And who will begin the conversation with you. And if they tell you you just need to go home and lose weight and all will be well, find a second opinion. That is not medical treatment. Telling someone to lose weight without giving you a concrete plan and explaining to you how, what, why, what may change with fat loss, what may not. Because half the people leave your office, go home and starve because they're depressed. They lose muscle instead of fat, and they come back to you less healthy. Okay, so perimenopause is marked by the drop in estrogen and the female hormone produced by the ovaries. Estrogen levels go up and down sporadically. That is why we do not have a great test for perimenopause to make the diagnosis, okay? I want to hear in the comments that what your doctors have told you. If you've gone to the doctor to discuss your menopause or perimenopause, hang on, black coffee here. Isn't my cup cute? I want to hear what you've been told. Tell me in the comments what your frustrations are, because I feel like I'm a one-man little band. I know there's some other experts out there who are trying to, but I mean, because I am in menopause and I feel like I've got to help my sisters out there and I've got to try to help educate other physicians and other healthcare providers, wave your flag and let me know. Tell me if what you've been told by your doctor. I want to see it. I want to see it. Also, if you're new, please like this video and share this video if you feel like this information will be helpful to someone else. Okay, so the weight gain is real. It's actually a documented fact, okay? Visceral fat gain and loss has nothing to do with caloric restriction. And I'm going to say that louder to you in the back. There's two kinds of fat in the body. If you've never heard this before, if you guys follow me for a while, you know what I'm talking about. But I'm going to just do a little background education here, okay? Visceral fat deposition has nothing to do with caloric restriction. Hormones control where and how we store fat, okay? Visceral fat deposition has everything to do with insulin, cortisol, leptin. Hunger and satiety is leptin and ghrelin, but visceral fat is completely driven by activity of your androgens, so testosterone, and it's driven by aging. It's driven by inflammation. Visceral fat is the fat that wraps around your organs. It is the abdominal fat. It makes you look pregnant. It's not this fat, okay, that I'm grasping here. This is skin, okay? I'm doing pretty well on my fat, but I did have children, so I got skin here. They stretched out. Visceral fat is the fat that makes you look pregnant, okay? It wraps around your organs. In and of itself, it's very different than subcutaneous fat. Subcutaneous fat is the fat that is under our skin. It gives us curves. It's the fat that comes and goes, when we have rapid weight change. Visceral fat is, you've got to decrease inflammation, and there are some hormonal things that you can do to decrease the deposition of visceral fat. Visceral fat is what determines your health. That is the fat that leads to diabetes, heart attack, stroke, cancer, etc. Okay? Visceral fat is real. And why I have this machine, okay, this is a $20,000 biometric impedance scanner to help me tell patients how much visceral fat they have. And then I make specific nutritional recommendations in order for them to try to bring that level down so we can improve their health. Okay, the scale, what I'm able to show people with this bioelectric scanner is look at where your weight's coming from. This much is body water. This much is intracellular water. This much is swelling. This much is your muscle, and this much is fat. Of your fat, this much is visceral, and this much is subcutaneous. And then I'm able to make individual recommendations of nutrition specifically for them. It's really the coolest thing I've ever done, and I'd love to teach other physicians how to do it. So, okay, so back to menopause. Menopause officially kick in when the ovaries produce so little estrogen that the eggs are no longer released, and you're done, and there's no going back. Okay. You can enter menopause earlier than normal. I have had hundreds of people reach out to me who were in premature ovarian failure, whose doctors missed it. They went in with classic symptoms of menopause in their 20s and 30s, and their doctors blew them off and told them, this is impossible, you cannot be in menopause, and they had premature ovarian failure, which was missed. Put your foot down and demand testing. Okay. Okay, so your doctor, if you are in your, late 40, if you're 45 to 55 and you haven't had a period for a year, your doctor can pretty much diagnose menopause from that. Okay, so you go through menopause earlier than normal if, number one, you have a family history of early menopause. Say that out loud to your doctor. Number two, you're a smoker. Smokers go through menopause earlier. Number three, you've had a hysterectomy or a oophorectomy. So if you've had your uterus removed or you've had one ovary removed, you are more likely to go through menopause earlier than you would have had you not have had those procedures done. Okay? And also, if you've undergone cancer treatments, chemo and radiation affect the ovaries and put you at risk for earlier menopause. Okay, all good things to know. Okay, so if those of you share this video, if you feel like this information, TikTok keeps giving me these little warnings. Like this video, give me the hearts and the love and all the things that you're supposed to, that they are asking me to give you. And please, please, please like this video. It really helps drive the algorithm. This is the biggest audience I've ever had, 895 people. Keep your questions coming because I will share this. Ask, please like this video. Oh my God, we're at 955. This is so exciting. Okay, all right, so straight up symptoms of perimenopause. Are you ready? Here we go. Irregular periods that are heavier or lighter than normal, worsening PMS, okay, breast tenderness, weight gain, especially in your midsection, hair changes, hair loss is huge, heart palpitations, headaches, worsening headaches, or new onset of headaches. That's what happened to me. Loss of sex, so change in your sexual interest, okay, change in how you feel about sex. Very, very common in perimenopause. Concentration difficulties and brain fog. Urinary tract infections, vaginal dryness, painful intercourse, and frequent UTIs and fertility issues in people who are trying to conceive. All, and more can be associated with perimenopause, and all are pretty much treatable. So if you are not sure if you're in perimenopause, take our perimenopause quiz. So I found a validated scoring system. So since we don't have a blood test that clearly tells us if you're perimenopausal, the way to make the diagnosis of perimenopause is a discussion with your healthcare provider. First, they must be open to listening to you and not blow you off right across the bat. Immediately get up and leave and go find another provider. Number two, here's what I tell people. If you go to my link up here and you click there, you go to my page for Galveston Diet and you see my picture, this glamour shot, and then you see information about me and a Target. Oh, look at that. Thank you. All these cute things. Go and click on the link. It'll say link in bio. Click on that. You will see, am I in perimenopause? There is a quiz there that you can take. It's free. And it will give you a score that will tell you the likelihood that your symptoms are related to perimenopause. This is a validated scoring system, and I didn't make it up. The Australasian Menopause Society configured this thing. Then it will take you into an email string. It will ask for your email address. And in that email string will be a shit ton of information about nutrition, diet, whatever, but also treatments that you can take to your doctor and say, here are the things I want to talk about. It will educate you and make you more aware so that you can be a better advocate for yourself, because I cannot clone myself and go with you to every appointment. Okay, if you're in Texas, please come and see me. I can do virtual visits. Check out my clinic stuff is Mary Claire Wellness, and it's maryclairewellness.com. Go check that out if you're in Texas. My license only allows me to practice medicine in Texas. So I cannot do prescriptions. I cannot do lab work. I cannot form a doctor-patient relationship with someone. So today I had a patient, my 9 o'clock drove across the state line from Louisiana. She drove 45 minutes, parked the car, and we had a virtual visit with her in her car. It was so freaking awesome. So I couldn't do the scale with her, but she did her waist-up ratio, and I was able to get all her history information, order her prescriptions, and get her started on the path to better health. Okay, so remember, if you have questions, please put them in the comments. I'll try to get to some of these at the end while I go through. So if you want to learn more about my nutrition program, it's called the Galveston Diet. Again, link is at the top of the page on my website. We also are having a sale right now. If you enter the code HOLIDAY, HOLIDAY at checkout, you'll save 20% on whichever program you decide is best for you. Also on our website, we have meal plans, information, videos, all kind of stuff, just education to have you learn more. And please, please, please take the perimenopause quiz. Go take the quiz. Okay, so more education and information. Also, I just did a TikTok talking about how crazy things that people tell their doctor, or doctors tell them. All right, so what else can I teach you about menopause? So cholesterol, perimenopause and menopause also increase your cholesterol levels. Did you know that? This is one reason why women in perimenopause and menopause are at increased risk for heart disease, okay? So when do you call your doctor? When does this become an emergency and you need to call your doctor? Call your doctor right away if you have spotting after your period. This could be a sign that something is going wrong. If you have blood clots during your period bigger than a quarter, okay? Blood clots bigger than a quarter need to be evaluated. If you have any bleeding after sex, that's not normal. Go see your doctor. This needs to be treated and evaluated right away. If you have periods that are becoming much longer or much shorter than others, okay, those are times to go and see your physician. So treatment options for perimenopause and menopause. Estrogen. Estrogen works by normalizing estrogen levels so that the sudden hormonal changes we go through perimenopause even out. When I have patients come in and we talk about their risk factors and what they're going through in perimenopause, even though they're still having periods, quite often we decide between each other it is mutually beneficial to consider some estrogen support during this time period. I do it all day long, every day. Estrogen is available by prescription. Of note, the Food and Drug Administration does not regulate the over-the-counter options, so be very, very, very careful. So a lot of you guys say, your doctors say it's normal, it's normal, it's normal. Cancer, okay, so normal, death is normal, okay? A lot of things that are normal doesn't mean that it doesn't make you crazy, doesn't make you feel bad, doesn't affect your quality of life. This is how you counteract this with your physician. I understand that most women have this. I understand that most women go through this. I understand that this is normal. However, it is affecting my quality of life, and I want to change that. What options can you discuss with me? Okay? Just because it's normal doesn't mean that you have to suffer. Menopause is normal. 100% of us will go through it. That's what normal means. The percentage of people under a curve that will experience the same situation. It doesn't mean that it doesn't affect your quality of life and that you have to suffer. So here's what you say to your doctor. I understand that most women will go through this, but it is affecting my quality of life. What can you do to help me? And if they're like, I got nothing for you, get up and leave. And ask for your copay back. The end. Okay, so let's talk specifically about the vagina, okay? Blood flow to the vagina in perimenopause and menopause starts decreasing tremendously. We experience change in the tissue of our vagina. It becomes thinner, it becomes less elastic, and it becomes more easily irritated, infected, and inflamed. Vaginal dryness is a serious symptom that can affect your sex life, okay? If it hurts, nobody wants to do it. So when some people come to me and talk about a decrease in sexual feelings, immediately I go into, is it painful? Well, yeah, it's dry and it hurts a little bit. No one, your brain says no. No. because it hurts. It's telling you not to do it because you are suffering. Okay? This is treatable. This is absolutely treatable. You do not have to suffer. Besides, lubricant is just a Band-Aid, but I love myself some lube. Okay? I think everybody should use lube every single time, every sexual encounter, even if you're masturbating, use lube. Okay? And you should masturbate, by the way. Vaginal estrogen can save your life, literally save your quality of life in ways you cannot imagine. It is treatment for recurrent UTIs. It is treatment for vaginal dryness. It will restore the tissue of the vagina to the premenopausal state. And it does not carry any risk of cancer. None. Vaginal estrogen. You should consider it. Talk to your doctor about it. It is so important. Okay, we have a bunch of new people on. Hi, I am Dr. Mary Claire Haver. I am the creator and founder of the Galveston Diet. I'm also a board-certified OB-GYN practicing medicine outside of Houston, Texas. If you'd like to come and see me, check out maryclairewellness.com. Make yourself an appointment. We'd love to see you. I can only see people who are physically in Texas because my license is for Texas. If you want to learn more about our nutrition program, check us out at galvestondiet.com or just go up to the link here. So please like this video. TikTok is really funny about liking videos. So they want me to tell you to like the video. Also, please share this video if you feel like it would be helpful to someone. And it helps me remain relevant in the algorithm. I really appreciate it. So I'm going to get to some questions now. Go ahead and start firing your questions off here and I will try to answer them. They go by really quick. So I will try to get them answered for you. Let's see. There's 940. Okay, my mom had a hysterectomy at 55. Are you at risk for early menopause? No, that does not put you at increase. If your mom had early menopause, it puts you at risk for early menopause. At 42, what are the odds of conceiving? You can Google that. There's some really awesome fertility calculators you can do online. You just put in your age and some of your medical history and it'll tell you the % chance of you conceiving each month. Timing, I just had my annual and asked for and received a prescription for estradiol. You go, sister. And if I had anything to do with that, thank you so much for letting me know. Oh my God, just knowing that people are, able to get the help that they need based on what I told them means everything in the world to me. Okay, the best treatment for perimenopause. Okay, here's my answer for everything. Nutrition first, maximize your nutrition. You can minimize your symptoms that way. Supplement any gaps in your nutrition and then consider prescriptions if necessary. There's power in a name. Hang on, soda and went away. Hey, there's power in a name. Okay. No period. Y'all, these questions are going by so fast. I'm so sorry. How do I feel about phytoestrogens? Great point. I love phytoestrogens that are found in food. And so many foods that we eat that are super healthy and also powerfully anti-inflammatory also contain phytoestrogens. Hang on, I'm going to pull up a list for you. So soy is one of them. So edamame, miso. So these are natural chemicals found in food, natural occurring compounds found in food that are similar to estrogen under the microscope. And they have estrogen-like ability, and they can go a long way to helping with menopausal symptoms. So, and they don't increase your risk of breast cancer. So, flax seeds are one. You want to make sure they're ground. So when I do so if those of you who follow me with Galveston Diet, one of my favorite ways to break my fast is with I call the Mary Claire Parfait. So I have no dairy issues at all. So for me, I do plain Greek yogurt, plain, nothing added. It's just the only ingredient is yogurt and it's full fat and it's Greek strained. And so I do plain Greek yogurt. Fage is my favorite brand. That's what they have at my grocery store. I do that. I do berries. I do my whatever nut floats my boat that day. So pecans, almonds, walnuts, whatever. That I do a tablespoon of ground flax, a tablespoon of chia seeds, and a tablespoon of hemp. I do all of that for the different phytochemicals and nutrients that are in them. And flax is a powerful phytoestrogen as well. Soybeans and edamame, I mentioned earlier. Dried fruit is a very rich source. Dates, prunes, and dried apricots are a few dried foods that are highest in phytoestrogens. Sesame seeds, also very rich in phytoestrogens. Garlic, peaches, berries, wheat bran, so the bran found from wheat, tofu, which is, of course, from soy, and cruciferous vegetables. So there is something called DIM you may have heard of. A lot of people ask me about DIM. DIM comes from cruciferous vegetables. It's a naturally occurring compound in cauliflower and broccoli. And so DIM actually changes the metabolism of estrogen into a less aggressive form that is linked, can decrease your risk of recurrent breast cancer. And so a lot of people who are with breast cancer take DIM supplements. It is found in cruciferous vegetables, but you have to eat a lot of them in order to get, in order to get the benefit. So DIM is something, if you're having menopausal symptoms and you are at risk for breast cancer, is something you would probably want to consider for treatment. Does evening primrose oil help with premenopause? It can. And so I used to prescribe evening primrose oil to my patients who had mastalgia. So a lot of my patients would come in with debilitating breast pain, especially during certain times of their cycle. And people use evening primrose oil to treat menopausal symptoms. All of that can be healthy. Let's see, your daughter is 16. She has severe cramps during her period time. So she's having dysmenorrhea. Severe dysmenorrhea is probably at 16 the way she's wired. It might be endometriosis. It's a little early for that, but it can be potentially a cause. So typically there's a couple of treatment options. One is nonsteroidal anti-inflammatory medications can work beautifully. They break down the pain pathway that the prostacyclins are setting off in her uterus and cause it. And so that'll be like Motrin, ibuprofen, Pamprin. It's better to take those before the period starts and then throughout her period. And also birth control pills work wonders for this. Both of my daughters had debilitating dysmenorrhea, and birth control pills were the cure for them. And they're still on them now for contraception or whatever, and acne, whatever they need it for. I really don't care. Okay. And so, more questions. Let me see. I have 99 new messages. Hang on, guys. I'm trying to get there. I'm 49, currently going through menopause. What kind of prescription? Well, if you're interested in estrogen support during your perimenopause and menopause, and it's an individual discussion between you and your practitioner. It depends on your family history, your risk of cancer. Okay, I'm just checking the time because I do have another patient. And so it really is an individual decision, but if you and your practitioner decide you're a good candidate, then you have if you have a uterus, you must do an estrogen plus progesterone combination to protect your uterus from endometrial hyperplasia and cancer. If you don't have a uterus, if you've had a hysterectomy or you were born without one, then you can do just estrogen safely, which would be, now as far as what form of estrogen, we have pills, patches, rings, creams, everything over the counter. I'm an FDA girl. I usually only prescribe things that are advised by the FDA. I try not to go off label, though I have in the past. Testosterone is not hormone replacement therapy. That is not recognized by the American Board of OB-GYN or any board certified OB-GYN. Testosterone has nothing to do with hormone replacement therapy. Okay. It is only estrogen and or progesterone. Okay, guys, let's see. More questions. What do we think of progesterone creams? Again, some of those are not FDA tested or approved, so you're going off the reservation. You may find it helpful. Hi, you're from Malaysia. Hello, what do I think of Estroven? So Estroven is an over-the-counter product that some women have found relief from their menopausal symptoms. It may be something that you want to consider. Okay, I'm getting more notifications. Hi, I'm Dr. Mary Claire Haver, board certified OB-GYN. We're talking today about perimenopause and menopause. I'm answering questions right now. Please like this video so that I can be more relevant on this stupid app. This is what TikTok is telling me to do. Also, if you think that you might be in perimenopause and you're not sure, we don't have a great blood test for it, and your doctor's blowing you off and tell you you're too young, what can you do? On my website, so if you go to the Galveston Diet page here on TikTok and you click there, you go to the top, there's a link bolded at the top of the page, and it's you click there and you just scroll down and look for, am I in perimenopause? That is our perimenopause quiz. It is a validated scoring system that looks at a constellation of symptoms and will give you the likelihood that your symptoms are related to perimenopause. They will then drop you into an email string and in that email, you'll get a series of emails which are going to educate you about perimenopause, give you a list of medications you can discuss with your doctor, talk about nutrition and inflammation and all of the things that you can do to help combat this. So again, it's our perimenopause quiz. And if you go to the link, it's my picture up here. If you go to the link up there, you'll see my TikTok page, and then there'll be a link there that you can click on, and then that will show you Galveston diet. It will show you, am I in perimenopause? Click on that and it will take you to our menopause quiz, which you can take and then give you a ton of information. I make no money. I don't care. It's not for, monetary purposes. It's for education, so that you can educate yourself to have a more informed conversation with your physician, and you can specifically ask for the medication that you want. Let's see. I've had Implanon in your arm for over 20 years. Well, it's probably time for that guy to come out. The Implanon, Nexplanon only works for 3 years max. So now it's a foreign body not doing anything. I would go ahead and have that guy removed. Let's see. Thank you for your useful information. You are so welcome. I love doing this, guys. It's so much fun for me. What do I think of Amberen? So Amberen has some reasonable data. It's another supplement that you can buy over the counter that has been shown in some women, not all, to be helpful. So it seems to be fairly safe, and it's the patients who have come back to me and told me that it helped said that they had to do it for at least 6 weeks. So it's not an overnight thing. Hang on. It is something that might help. It's not dangerous, and but you need to take it for 6 weeks. So anything to do for crepey looking skin. So I invest a lot of money in my skin. You definitely, there's a bunch of plastic surgeons and dermatologists here on TikTok. Follow them. Just go to the search button on TikTok and look up, there is Dr. I have to pull up his name. I follow several dermatologists, and I just do what they say. Dermatologists and plastic surgeons on TikTok. Dr. Prem Tripathi. I think it's Prem Tripathi is my favorite. There's also some derm residents who do a lot of great education and stuff about, I use vitamin C, I use hyaluronic acid, I use a really great moisturizer, and I use a retin-A to help with my skin. So sorry, we got off topic. Let's see. You cannot take hormone replacement therapy. Any suggestions? So depending on what symptoms you're trying to treat, there are definitely, nutrition needs to be maximized. If you are not on HRT, or you're choosing not to take it, or you can't take it, you must maximize your nutrition. And if you're looking for a great program, I have one. Okay. Shameless plug here. It's called the Galveston Diet. You can find out more about it. The link at the top of my page. We're having a sale right now. It's called Holiday, HOLIDAY. You put it in at checkout to save 20% on your choice of program. We would love to have you learn more about us. Also, our website has a ton of free shit on there. Videos, information, blogs. Go check all that out and see if you feel like, no, HRT is not dangerous. It is not dangerous. It is not dangerous. What's dangerous? Obesity. Okay. You are 6 times more likely to get breast cancer if you're obese. There's no increased risk of death from breast cancer if you're on HRT. Did you know that? No increased risk at diagnosis. If you are on HRT at the time of diagnosis, you do not have an increased risk of death versus women who are not on HRT. Did you know that? Estrogen alone has 0 increased risk of breast cancer diagnosis. It's only estrogen plus progesterone, and it was women in their 60s. Okay. There's so much misinformation. The WHI has been disproven on so many different levels. You guys, it is there are so many other risk factors that you can modify. And then, so that was my choice. I got my nutrition on point. I have no visceral fat. I have no other risk. I have a horrible family history, but my quality of life is so much better on HRT that I decided the 1.2 increased risk for me based on my scoring system was worth it, because I had lowered so many other risk factors by being healthy. HRT is hormone replacement therapy. I'm sorry, guys. I thought everybody knew that. I apologize. It's hormone replacement therapy given to a perimenopausal or a menopausal woman. So, how to get rid of stomach gain, the Galveston diet. Check us out at galvestondiet.com. HRT reduces the risk if you flipping the F out on your family. I hear you, sister, right here. Boom. Fuck yeah. Truth in my house, at least. Let's see. You're so overwhelmed with all of the changes. You know what? I cannot tell you how many women came to me and said, I wish I knew. I wish someone would have told me. What I'm trying to do here, I just feel like I've just got a little flag and I'm waving it on TikTok. I'm just trying to educate you. Make sure that you know what's going on. Talk to your daughters. Open the conversation. Make sure they know. Just the education part of it will alleviate so much of this and make you feel like you're not fucking crazy. Educate your daughters. Financial literacy, medical literacy, menopause literacy. Teach them everything. Everything. Okay. Can you take HRT if you're already in menopause? Yes, you can. Yes, you can. Absolutely, you can. Okay. How about birth control for perimenopausal symptoms? Yes, that is the most common thing I prescribe in perimenopause because it's cheap, easy, we know the side effects, and we got 50 million options, okay? Abso-freaking-lutely. What tests would you suggest to find out what is causing body inflammation? We have tests that are non-specific. All I can do is tell you you're inflamed, but it's hard to tell you why. Nutrition is the way to go. An anti-inflammatory nutrition program, which is the backbone of the Galveston diet. Check us out. Okay. My skin is beautiful. Thank you. I work hard at it. I have told my daughters. Good. Okay, good. I'm reading the questions. All right, guys. Can you take HRT if you're, they're flying by. I have 71 new comments in just 5 minutes. I really need to know how long menopause lasts. Menopause lasts forever. Once you're in menopause, it never goes away. Menopause lasts forever once you go through it. You'd never come out of menopause. Your symptoms may change, but you will be in menopause and have the health risks associated with menopause forever, okay? We can't undo menopause once it starts. It's like undoing puberty. Once you go through puberty, you're not going to become a child again, okay? It's forever. Does that make sense? So menopause is going to last forever. Your symptom profile may change with time. And everybody's menopausal symptom profile is different. Very, very different. Using a one-size-fits-all, everybody gets X, Y, or Z is not good medicine. It's not the way to practice. Okay, so you had a total hysterectomy. What vitamins should you take to prevent bone loss? Okay, so nutrition is one of the best ways to prevent bone loss from menopausal changes. So hysterectomy does not make you lose bones. Oophorectomy will make you lose bones. Okay, so estrogen, there's lots of estrogen receptors on the bones, but if you still have your ovaries, this may be not an issue for you yet. You must make sure you're getting enough vitamin D, you must make sure you're getting enough calcium, and you must make sure you are practicing resistance training, working that musculoskeletal unit to keep it strong, to keep that signal going to the muscles and bones. Stay strong, stay strong, stay strong. If you're not doing that, you are undercutting yourself dramatically. So, okay, I'm getting another warning. Hi, I'm Dr. Mary Claire Haver. TikTok makes me do these sporadic introductions because so many of you come and go. I am a board certified OB-GYN physician. I practice medicine. I have a wellness clinic in Houston, outside of Houston, Texas. You're welcome to make an appointment to come see me at maryclairewellness.com. You can learn more about my practice there. You must physically be in the state of Texas when I see you. So I do virtual visits, but I just had a patient today who lives in Louisiana and drove over the state line 45 minutes, and we had a virtual appointment via her laptop in her car. That's what works. I cannot practice medicine outside of the state of Texas. learn more about me at Mary Claire Wellness. I do have a nutritional program. That is the Galveston Diet. It is at galvestondiet.com. We have a sale. It's called Holiday, HOLIDAY, to save 20% on whatever you want. I'm board certified OB-GYN. I'm also a nutritionist. So that is my passion, is education. I do a lot of teaching here on TikTok about menopause, sexual dysfunction, weight gain, staying healthy as you age. Please like this video so TikTok will keep me relevant in the algorithm, and will put me on whatever live spotlight. They're always changing stuff. I never know what's going on. And for some reason, I've become popular on TikTok as a 53-year-old woman, much to the horrification of my children. So let's see. You are looking for natural hormones. Okay, there are what we call bioidentical hormones available from the FDA. You just talk to your physician about them. They're absolutely there. All right, guys, I have to get ready for my next patient. It was awesome talking to you all. Give me some likes on your way out. Please, please, please like this video. Give me some of your hearts and your shares and all the good stuff. And please share this video with anyone you think it might be helpful. And make sure you follow me, because I have lots of great information coming your way, and like this video. And if you are concerned that you might be in perimenopause and you're not sure, take our perimenopause quiz. Take the perimenopause quiz. It's on the link on my page here at Galveston Diet. If you go to the top, click there, look for Am I in Perimenopause? Take the quiz. It will give you a score, drop you into an email string, which is going to give you a shit ton of information about perimenopause and menopause, so you can have an informed conversation with your doctor. All right, everybody, have a great day. I got to get ready for my next patient. I'm so glad you were able to spend this time with me, and we'll chat again soon.